Osgood Schlatters disease is a common cause of anterior knee pain in children, especially those that are very active, and in this video we will explore options for managing it. Hi everyone and welcome to Exercise for Health. I'm Richard and today I'm going to provide advice for children suffering with Osgood Schlatters disease. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Firstly, let me begin by giving you a brief overview of what Osgood Schlatters is before showing you ways of managing it. This condition normally affects children aged 8 to 14 when they're going through a growth spurt. The rapid growth in the length of the thigh and shin bones over a short period of time causes an increase in tension of the quadricep muscles and tendons on the front of the knee. If the child is particularly active during this time with lots of high impact sports, then there is an increased risk of tendinopathy at the tibial tuberosity. This is where the patella tendon attaches to the shin bone. As a result, the tendon can pull on the bone or growth plate, causing pain, and if not managed correctly, can leave a bony lump below the knee joint into adulthood. 1 in 10 children can experience this condition, which causes knee pain during squatting, kneeling, jumping, or whenever stress is placed upon the quadricep muscles during everyday activities. Essentially, the pain symptoms are temporary, lasting a few weeks or months, and will eventually reduce when the period of growth slows down. But more recent research has shown that issues with knee extension strength and functional ability can be affected in the long term if not treated correctly. So if your child is presenting these pain symptoms at the front of the knee, the first thing to do is to reduce the frequency or intensity of their activities that are aggravating it. This doesn't mean stopping activity altogether, but controlling how much load is placed upon the muscles and tendons and how often. For example, it may be that football training 4 times a week, as well as 2 competitive games at the weekend, will be too much and cause too much pain. So this will need to be reined back in a bit so you can find a balance that is more manageable until the pain subsides completely after the growth spurt. To determine what is okay and what is not, using a pain scale of 0 to 10 during their activity, the child should experience pain no higher than a 2 to ensure the symptoms in the long term can be reduced and the condition can be managed effectively. Activities causing a pain of 3 or more indicate the child is doing too much. It may be that you look to incorporate alternative activities during this time that are lower in impact and less demanding on the knee, such as cycling or swimming, while their main sporting activity is reduced temporarily in the short term. As well as modifying the amount or type of activity, they can also try to strengthen the muscles around the knee to increase the capacity for load in preparation for returning to more competitive play or building back up their chosen sport. In the initial stages, within the first month of diagnosis, exercises such as a lying bridge or seated knee extension can be performed at home for 10 reps, 2 or 3 times every other day alongside their other activities. These will begin to build strength in the quadricep muscles that will have the greatest impact on the pain symptoms in the front of the knee. After the first month, other more progressive strength exercises such as a wall sit for 20 to 30 seconds or more, slow squats pausing at the bottom for a count of 5 before returning to a stand-in position for 5 to 10 reps, and slow controlled split squats where the back knee almost touches the ground and the front knee stays in alignment of the foot, placing more emphasis on the front leg for 5 to 10 reps, can be an effective way of building strength into their quadriceps. These can be done 3 or 4 times on 3 days a week. Note that I haven't suggested adding an additional load such as a weight, as this could be detrimental at this stage. However, performing the exercises with their body weight in a slow controlled manner will be most effective at increasing the capacity of the quadriceps and tendons whilst reducing the pain symptoms in the long term. Finally, doing some dynamic stretching before an activity for the quads and hamstrings, or doing some foam rolling for a couple of minutes before their main activity may help alleviate symptoms during their sport participation. Likewise, flexibility exercises for the muscles around the knee, such as a static quadriceps or hamstring stretch for 30 seconds or more, can be useful at the end of an activity or can be done at any time of the day and may help control the pain symptoms in the short term, but it won't be as effective as the strength exercises in the long run. However, if it makes them feel better, there is no harm in it. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.